All right, welcome back to my channel. And so the new year is upon us, and this will be the first video in the new year 2020. So I just want to use this opportunity, this medium, to wish you a happy new year. And I pray you crush all of your goals, you excel in everything you'll be doing. And for those sitting for the MDCN exam or any other medical exam, I am wishing you the very best and hoping all of your dreams and set goals come to fruition. All right. So in this video, we'll be talking about a very important part of the MDCN exam, the OSCE part to be precise, which is counseling. Counseling is not just an important part of the exam; it's also an important part of our medical careers, because you do a lot of counseling, you do a lot of interpersonal communication with patients, talking to them about their situations, sharing bad news, passing advice, making them understand what ailments they're suffering from, and easing the stress on them, basically. So in the last exam, a question came out in the OSCE, which was on uterine fibroid. On the patient had uterine fibroid, and the question was, advise the person she was going to have a myomectomy. She was going to have a myomectomy, and the question was talking to her about the surgery and the disease itself. We had to find a way to demystify the surgery to her, make her understand what it really entails, and then talking about the disease itself, making it clearer as to what she's dealing with here. So that's what that was about. So it's a pretty important part, and that was a whole station. Sometimes 2 stations come out on this, so it's pretty important we know how to do it. And the good part of it is that it's not rocket science. It's actually a walk in the park. It's very easy. Once you know it, you know it. It's like riding a bike. You can't forget how to ride a bike. So just know it. It's very easy. So in this video, we'll be focusing on MDCN counseling, as I said before, and then we'll be having a few case studies. We'll be using examples like breastfeeding. That's like counseling the nursing mother on the importance of breastfeeding and the techniques of doing that. So, and the second one will be like a couple with genotypes AS and AS, and the risk of getting married, or the risk of producing offsprings, and so we'll be basically talking about the options they have and how to deal with their situation in general to avoid sickle cell, is to avoid birthing a sickle cell child, or how to prepare for a sickle cell child. So without further ado, let's get into the business of the day. So as you can see here, we've divided the counseling for better understanding into 5 steps, which we've acronymed GATHER. So we have G for greet, A for ask, T tell, H help, E for empathize, and R for recall. So it's called GATHER. So once you can pass through all of these steps chronologically, and you don't miss anyone, and you try to touch on each and every one of these steps, you'll be fine. Some people use other acronyms or so. Some people say spikes. I've heard of spikes. I've heard of some other ones. But what we'll be applying here today is an acronym called GATHER. So let's get into it. Let's get to the first part, which is greet. So as you can see, greet is the first part of the acronym. And we'll be talking about, in greeting, of course, just like regular greeting, a patient comes into the door, you need to greet the person. You can't just start talking without first greeting the person. So we'll be talking about greeting and how to create a rapport. Okay, and because a rapport, it's pretty important that you create a rapport before talking to a patient, so the patient feels comfortable with you. The patient doesn't feel like you are some god and they can't ask you questions, and in a way that limits the understanding of the patient, and that kind of makes the conversation one-sided. So you want a very balanced conversation, not the lopsided conversation, very balanced and calm, collected, cordial environment. So Uh, the first part is greet. I've clearly stated what you should say here, so you just need to kind of rote learn this, put it into your head like that. So just like regular greeting, you say good day, sir, good day, ma. My name is so so. For example, I would say my name is Ajibade Tolulope, and for the purpose of this exam, I've been asked to talk to you about. I've been asked to talk to you about. Let's say, what was the first one we said? Breastfeeding. So good day, ma. Good day, sir. If it's a ma or sir, let's say a man now, since it's breastfeeding. Good day, ma. My name is Ajibade Tolopia. For the purpose of this exam, I've been asked to talk to you about breastfeeding. Is that okay, ma? Then the person will say yes. You need to wait and ask for consent. Okay, so is that okay? Some will say, can I go ahead, ma? Some will say, is that all right, ma? You understand? Are you comfortable with that, ma? So consent is really, really important. I cannot stress this enough. You know, I've mentioned that in the previous videos as well. How important consent is. So you need to ask, is that okay, man? Don't just say I've been asked to talk to you about this, then you move on. No. Make sure the person agrees to what is being done. Okay? So is that okay, man? And try to talk as fast as possible. If you notice that I did it really fast while talking. So the next thing you do after greeting is you elicit the bio data of the person. So you ask, so what's your name, man? How old are you? What's your level of education? And are you comfortable speaking English? So the level of education and the comfortability speaking English is pretty important because the counseling will be in English. So imagine the person doesn't speak English. Maybe the person speaks the traditional language of Hausa or something. You have to bring down the counseling to the level of the person. So you need to adapt your speech to the level of that person's understanding of English language. One other thing you need to note is that if the person is not comfortable speaking English, you need to ask, do you need a translator? You understand? But most likely for the exam, they'll put someone who can speak English. But just to be on the safe side, you need to confirm that because I guess it's has a mark to it, okay? So the next thing you gotta do is talk about confidentiality. So I would like you to know that there is a doctor-patient confidentiality between the two of us, and whatever we say today won't be divulged to a third party, okay? You understand? So that is important. Talk about confidentiality. Make it clear, you know? It's pretty important. That makes the patient more comfortable with you. And then you talk about, do you feel comfortable here, or would you like us to change the room? Would you want to be with a friend or with a loved one during this conversation? That is just to make sure the patient is calm, make sure the patient is comfortable. All of this is just a way of creating rapport between you and the patient, you know, making sure that the patient is comfortable, as I stated before. So basically, that's all for greeting. You know, you just run it through. It's the same. It's generic for every counseling. So once you know this part, you know it. So let's move on to uh, ask. What is ask about? Why do we do it, and how do we ask? So we've made ask mean consent and courtesy. So it's really important to be consensual and courteous in whatever you do. And you need to make this clear because I mentioned consent in the first step, but sometimes the examiner could miss that and you want to make it very clear, you know. So first ask, what do you know about breastfeeding? What do you know about the process of breastfeeding, ma? You need to make the person understand that he or she is heard. You know, people like to feel heard. There's a saying I've heard, nobody cares how much you know until they know how much you care. Okay? So the first thing is make them understand that you care about what they know, you care about their situation, and you are ready to share with them. So that gives them a level of acceptance to or a level of openness to whatever information you'll be telling them. Okay, and people tend to forget this step. They feel they've done it they've done it in the first step, and they shouldn't do it again. It's really important. So make it a note to make it a note to focus on it. Okay, and try not to forget. So let's move on to the next step. That's all for ask. So the next step is tell. Now, tell is where the work really is. Okay, uh, it's really important that you you focus on this in this is what you really prepare for, because the rest are basically generic, and this is where you really prepare the most part for. So once you know the disease in question, once you know the situation in question, if you have a basic understanding of breastfeeding, a basic understanding of sickle cell disease and ASAS handling and all of those things, breastfeeding, uterine fibroid, you will be able to handle this part well, in my opinion. So the major work here is finding a way to be sequential and not miss any vital information, and explaining this information in simple words. You know, they say you don't understand a thing until you're able to explain it to your grandmother. So that's the work. You know, it could seem easy, but actually explaining simple medical terms. I said difficult medical terms, maybe not difficult to us, but you know, medical terminology, and explaining that in the layman's language, you know, in basic English. So that's where the work really is. So for this part, we've made it easier. There is an acronym called BRCAP. 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 I don't know. Doesn't make any sense, but sounds okay. Does it sound well? BRCAP. So just know BRCAP. And that is what we follow for this day. But the first initial question you should ask, after you've asked, what do you know about breastfeeding, for example? What do you know about breastfeeding? And the person has told you. Don't let the person speak for too long, okay? It's not the person counseling, it's your exam, okay? So just listen. They just want to know you asked the question. So just listen for like 2 seconds and say, okay, would you like to know about it? Would you like to know more about it? That's the initial question you should ask, okay? That's the initial question you should ask. What do you know about? Would you like to know more about it? So about breakup, let's pick it. Let's take it step by step. Okay, let's look at the major key. There is a very important thing you should look at when it comes to tell. Always remember that the reason you've been told to counsel this patient is that the patient is mostly worried about the situation, and so your job is to ease off that stress. Your job is to, you know, alleviate the pain, the emotional, the mental pain it could be causing on the person, and pacify the person basically. And so you need to be as polite as possible and make sure uh, you are extremely polite. Like always saying, "Ma, would you like to hear about this, Ma?" All right, I understand, Ma. So put those simple, polite words. You know, it doesn't hurt to be hyperbolic. You know, you could go over and beyond. You know, making sure the examiner knows you're being polite. Okay, now this is very important. You know, because maybe you're really interested in a particular topic. You know, and you're asked to counsel someone on that topic. It could be difficult sometimes, not being overly pedantic, or how would I call it? You know, when you talk so much about this topic, so you're gushing about it. So try to caution yourself on that, and uh, just speak on what you have to speak on. Don't go into the details of it, okay? And then use simple English, as I mentioned before, because medical terminology, believe you me, sounds. I think we all believe that. We all know that it sounds really scary to the common man. Okay, so try to take it down a notch. Okay, let's get into breakup. Benefits. That's the B part of breakup. Benefits. So the first thing you need to talk about is the benefits of, or are the benefits of either undergoing the procedure in question, or the benefits of maybe it's about alcoholism, the benefits of quitting alcohol or quitting smoking, the benefits of breastfeeding, uh, the benefits of heeding to advice given to ASAS couples. So you talk about the benefits of this, and why they should do this. For example, breastfeeding. You could say breastfeeding helps to ward off diseases, allergic conditions in the child growing up. It also helps fighting disease conditions like breast cancer, cervical cancer in the mother. It also is the best food for the child. It contains vital nutrients for the optimum development of the child. It also helps in creating a bond between the mother and the child. It helps in bringing the mother back to the to the pre pregnancy, body physique. It helps with fitness. So you mentioned the likes of that. Once you mention three, four of that, you should be fine, and then you move on to the next. Okay. So benefits, and then the R part of it, which is the risks of not undergoing the procedure. Okay. So for the risk of not undergoing, basically it's the opposite of benefits. So you just look at the repercussions of that. You could say the patient will be exposed, and you don't need to spend so much time on this since you already talked about benefits. So for you could just find the opposite of this. Just say, if you don't breastfeed your child, there is a risk of you being exposed to the child being exposed to allergies, you being exposed to diseases, you not getting back to your fit state as quick as possible. This bond between mother and child may not go as you want it to. It may not be as close as we would like it to. So those are some of the risks of not doing it. And then you move to the next step, which is C, complications. In complications, basically, you spell out the possible complications of the procedure, some things that could occur, some negative things that could occur from this procedure. For example, if it's smoking, you could say it could be difficult. It could cause things called delirium tremens. It could cause, you explain what delirium tremens is. You understand clearly, don't just say delirium tremens. You could say it could cause irritability, it could make the patient, things like that. And then if it's for breastfeeding, you could say it could be difficult, it could be stressful on the mother or the child, considering that you have to breastfeed your child a couple of times a day. Maintaining proper hygiene, sometimes preserving the milk could be difficult, for the mother and the family in general. Waking up late just to feed the baby, those are possible things that could make it difficult, and all of that. So you talk about this, and don't spend too much time on that. Okay, just one should be enough. Because you're trying to make the situation better, not worse, okay? So, and then brief cap. So the A in the cap is alternatives. So are there alternatives to breastfeeding? Here you're expected to put forward alternatives to the procedure or the course of action being advised. For example, if it's smoking is a cessation, you could say the alternatives like nicotine gums, their patches, nicotine patches. You could put, things like that. And for breastfeeding, you need to make it clear that some mothers choose to not breastfeed their child, but it's not advisable because the breast milk is the best food for the child. You understand? And you won't advise, as a doctor, you won't advise going a different means or feeding the child with formulas. So you won't advise that. So you would advise, sorry, I have like a frog in my throat or something. So you would advise sticking to breastfeeding for the first 6 months at least, okay? And then, what comes next? Can you guess? Breakup. So that's a P. So what's P? So this is where you talk about the procedure. That's the steps to be taken. And it's really important you get to this step quickly because it's really important. I don't know. That's like the real body, That's what they really want you to talk about. So the steps to be taken in the preparation for this procedure, and be sure to speak chronologically for clarity and professionality. So don't just, for example, if it's a surgery, don't talk about post-operative care before you talk about pre-operative care. So you take pre-operative, intraoperative, and then post-operative. It's a surgery. If it's a surgery, if it's something like breastfeeding, you need to talk about it chronologically. For example, you talk about how to dress up. You tell the woman, make sure you try not to wear very tight bras or tight dresses. Try to make sure you maintain proper hygiene. So you see, we've not talked about how you actually breastfeed. We're taking it from the beginning of it, the preparation. So talk about, so for breastfeeding, what you need to do is maintain proper hygiene of your breast. Make sure you clean it as regularly as possible. Make sure you don't wear tight bras. Make sure you breastfeed the child. Is it 8 times a day? Make sure when you're breastfeeding the child, you alternate the breast every 30 minutes. Don't stick to one breast for so long. Make sure you alternate it to avoid sores and all of that. And make sure you also lift the baby's head so to avoid like food aspiration and stuff like that. You make sure you bring the baby to the breast, not the breast to the baby. So carry the baby towards the breast. Let the baby feel that closeness to you. You know, because some mothers will just take the breast and pull it to the baby, which isn't advised. Make sure you don't use drugs like what's it called, radioactive isotopes. Don't use bromocriptine, tetracyclines, I believe. So you just mention things like that. Another thing is you should breastfeed a baby based on demand. Don't just breastfeed the baby because you feel you should. So when the baby demands breast milk, you give to the baby, and then you could refrigerate the milk. You could suck some of the milk into feeding bottles, and then refrigerate that. So in the fridge it could last a day, and in the freezer it could last up to weeks. So that could make it easier on you, you know. So breastfeeding. So that's the procedure we're talking about now. So you talk about these basic things and how long the baby should be breastfed for, like 6 months on the minimum. Okay. And then help. Now this is the other part. So we're done with gather, we're done with tell. So help is the H part of gather. Okay. So what does help really entail? So this step is done if the case is in the procedure. Okay. So if it's not like myomectomy, appendectomy, any of those things, you need to talk about this step. Okay. Because if it's a procedure, then BRCAP already encompasses the. So if it's a procedure, you know, you've actually touched on this in BRCAP. But if it's not a procedure, for example, if it's like ASAS couple, which we'll be doing in more detail at the end of this video. If it's ASAS couple or a disease state like tuberculosis, diabetes, and the rest, once you're done with TEL, and you know TEL is enlightening the patient on the disease in question, you move on to treatment options. You understand? So if it's ASAS couple, you kind of talk about, if it's diabetes, for example, you talk about treatment options. If it's type 1 diabetes, you talk about use of insulin and how to do that, and possible ways to avoid health outcomes. Let's look at ASAS couple for a bit. So you could mention things like the options for ASAS couples. There are 5 options for that. We'll be mentioning that at the end of this video when we talk more on ASAS couple, like it's in the exam. Okay, so wait for that. Wait till the end of the video for that. Okay, so before we move on to the next stage, I just want to tell you, if you've not subscribed to this channel, you should endeavor to subscribe. It goes a long way in making us do what we do. You know, it takes time, it takes effort, it takes mental energy and the right, it takes money even, you know, putting out all of this. And just as a form of encouragement, I would love you to subscribe and like this video, comment on it. If you have ideas on what you want us to do, comment. And you can click on the bell button next to subscribe, just so you get notifications when next new videos are released. Okay, so moving on. We've talked about help. Let's talk about empathy and recall. So you can see I have this in gray, ER. So we have empathy and recall. So how do you empathize with a patient? Now, empathy cannot be overemphasized, like I mentioned here, and it has to be learned. You need to learn how to empathize. How do you do this? Some people would say, is it not from your body language? They know if you're empathetic or something. But what I would say is you need to make it clear for the exam, okay? So you could say something like, I understand this, it could be hard having to breastfeed your child a couple of times a day. However, it's important we go through all of this stress just to make sure we are fine and our babies are fine. So I understand that it could be difficult, having to pass through all of this stress and having a baby as AS couples. But however, it's important that you know that the stress that could arise if you don't follow this advice could be even worse. I understand this, and we know how difficult it could be. If it's a procedure, make sure the person understands that even in help as well and in empathy, help and empathy together, you could say, I understand this could be a little scary for you having to go under the knife and be under anesthetic that's where you don't know what is really happening during the procedure. But I'd like to assure you that we've been doing this for several years. We have expert hands at this. We have some of the best doctors who have been doing this for so many years. So we know what we're doing. And we are ready to give you the very best care possible. We're going to put out all the stops to make sure you are fine. So you don't have to worry about this, okay? So you mention things like that. Just try to be empathetic and make sure the person understands that you are in this together. You get what I'm saying, yeah? So basically, that's what empathy entails. Now, questions. This is very important, because sometimes you miss a step, or you didn't mention something while talking, which could carry a mark. And when you ask questions, the patient in the exam could actually ask you, Ma, could you please tell me something, 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 which most likely is what you didn't mention in the during your speech, okay? So this section is satisfied by asking three questions. Three questions. So what are these questions? Do you understand all I have said? Okay. Do you have any questions for me, ma? And when the person asks questions, you need to give answers to them. Don't just ask questions and then leave it at that. You need to give us answers to them, okay? So do you understand all I've said? Do you have any questions for me, ma? Could you please recall in your own words what you remember from our conversation? So this is important that you do. So you recall, make the person say it in their own words, and then you correct the person if the person makes any mistakes, okay? So that is just to confirm understanding of everything you've said. You may not be, one thing I'll say is try your very best to go through all of these steps one after the other. But you may not be able to go through all of this. Just try to touch on as many as you can and touch on them in the right way. But I'll tell you, endeavor to go through all of them because they all carry a point, okay? So touch on as many as you can. When you're practicing, practice with 4 minutes. Don't practice with 5 minutes, okay? A week to the exam, start practicing with 5 minutes so you know what you can do with how to manage the time because you don't want any awkward moments when you're done with counseling and you still have a minute. So practice several weeks to the exam. Practice with 4 minutes. Try to go through all of that in 4 minutes. Different topics. Have a list of topics, go through all of this with. I could give you possible high yield topics. Yeah, I'll check the comment, the description section. I'll give you a list of possible topics that you should, not possible, like important topics you should learn, both for yourself, for your medical careers, and for your exam. So go through all of this. And there's something else. For a procedure, you need to ask the patient to sign the consent form. So you say, okay, thank you very much. After the patient has done recall, if you have time, then say, could you please sign the consent form so we can have a go ahead on the procedure? And after doing that, you need to say thank you. So when I say go through everything you can, once the time is up, do not forget to end it with a thank you. Because that's another clear evidence of you being courteous, okay? So end it with a thank you. So what I would say is, thank you very much, that's all. And I move to the next station, okay? Now, another thing we talked about was the AS couple. So I'd like to just quickly talk on that right now. So let me give a typical example of AS couple, and I'll time myself, okay? Let me see if I can do that in 5 minutes or maybe less. So good afternoon, Ma. Good afternoon, sir. My name is Ajbaito Lope, and for the purpose of the exam, I've been asked to talk to you about your situation, which is the AS, you being your genotype being AS, and that of your wife also being AS, and you being a couple. Okay, and we'll be talking about your chances of having a child who isn't a sickle cell child. Okay, is that all right, Ma? Can I go ahead, Ma? Okay, thank you very much, Ma. Before we move on, I'd like to make it clear to you that there is a confidentiality agreement between you and I, and whatever we say won't be divulged to any third party. I also like you to know that if you don't feel comfortable here, we could always change the environment. Do you feel comfortable? Would you like to have a family or a friend with you during this process? Okay, thank you very much. And I also like to know your name, sir. What's your names, your sir and ma, your ages, okay, and what's your level of education? Are you comfortable speaking English, or would you need a translator? Okay, thank you very much, ma. Thank you very much, sir. So, what do you know about AS couple? Okay, thank you very much, sir. Thank you very much, ma. Would you like to know more about this? Okay, thank you very much. So basically, AS couple is your genotype, which is AS. It contains the sickle cell gene. Each of you, the S there denotes you having the sickle cell gene of your two genes. And since you and your wife both carry, the two of you both carry the sickle cell gene, there's a risk of your child having both of the genes, and that is where it becomes a problem. Having two genes, that's SS. That's where it becomes a problem, and the child becomes very sick easily. The child's red blood cells tend to die very easily, so the child gets sick. The child has to pass through regular hospital visits, regular blood transfusions, and the rest. So we're looking at your options and how to deal with this situation. Okay, thank you very much. Basically, there are 5 options I would advise for you going forward, and one of the options is adopting a child, okay, which is where you don't have to produce a child, and you take away the risk of you having an SS child. So you just adopt a child who isn't SS, and you are fine. Another option I could actually advise is something we call IVF, which is in vitro fertilization. That is where we fertilize the wife is fertilized with the sperm of a man who isn't AS. So there is a zero risk of the child being SS, okay, being a sickle cell child. So we fertilize the egg outside of the woman, and then we implant the egg after fertilization into the woman, and then it grows into a baby. Another option, which is pretty expensive, costs about 4 million, is the pre-implantation genetic testing. So this is where, instead of using a different man's sperm, we actually use yours. It is tested for your different options are tested, different fertilized options are tested to make sure it isn't AS, isn't a sickle cell zygote, a sickle cell baby being formed. And when it is confirmed, the fertilized egg, which isn't SS, is implanted into the woman, and then that grows into a baby. But it also comes with a risk, and it's also pretty expensive. Another option we could give is a childless marriage. That's a marriage where you have no children, and that way you have no risk of having a sickle cell. Then another option is you undergoing the natural conception and then bearing the risk of having an AS or a non-AS child. The risk of having SS, the risk of having an SS child is 25%. So there's a 75% chance you do not have that. But this is not very well advised. And I'd like to make you understand that I understand that this could be difficult, this having to pass through all of this process just to have a child. But I would like to make you understand that it is the risk, the pain now is better than the pain of having an SS child. So it's better advised if you do not just leave it to chance, okay, and follow this advice. Okay, thank you very much. Do you understand everything I've said today, sir and ma? Okay, thank you very much. Do you have any questions for me? Okay, thanks a lot. Can you recall everything I've said today, sir? Can you recall everything I've said today, ma? Okay, okay. All right, thank you very much, Ma. And thank you very much, sir. Have a nice day. So, you'll notice I finished before time. I touched on the great ask, tell, help, empathy, recall. And one other thing you could have mentioned, since this isn't a real procedure that way, you could ask for go ahead with any of the methods elicited. You could say, oh, we have professional hands in IVF. So if you're ready to go through this process or through this procedure, you could visit us at any time. We have professional hands in dealing with this. Okay. And that way you are fine. So that wraps up our video for today. If you've not subscribed to this channel, do well to subscribe. Comment on this video. Let me know what you're thinking. Let me know what options, what other ideas you want me to touch on. What are some things that are burdens on you that you want me to address with you? If I can't address it, I consult other doctors who have also passed through this examination, and then we could give, well-informed advice. So I'll be expecting you to like this video. It does help it does help a lot on YouTube. Okay, thank you very much. Have a nice day and have a very fulfilling year ahead. Okay, goodbye for now.